My name is Maria Paula Alvarez Mesia. My topic is fracture prevention with Zoledronate in older women with osteopenia. Definition: Zoledronate, also known as zoledronic acid, has characteristics that make it attractive for use in women who has osteopenia. It is administered by intravenous injection and intervals of 1 year or longer. It is preferred over orals beforehand by a majority of patients, and it has a satisfactory safety profile. The current data assesses the effect of Zoledronate on fraction in postmenopause women, with his bone mineral density that is characteristic as osteopenia.
In postmenopausal women with osteoporosis, bisphosphonates are first-line treatment for the prevention of fractures. Fractures can also occur in women with osteopenia, defined as a T-score between -1.0 and -2.5. Evidence for treatment in these women is lacking. Zoledronate, also known as zoledronic acid, is an intravenous bisphosphonate that is administered at intervals of 1 year or longer. In this randomized double-blind placebo-controlled trial, postmenopausal women 65 years of age or older with osteopenia were assigned to zoledronate or placebo. The primary endpoint was the time to first occurrence of a fragility fracture, defined as any non-vertebral fracture, and vertebral fractures as confirmed by radiographic evidence. 2,000 women with osteopenia were randomized to receive 4 infusions of either zoledronate at a dose of 5 milligrams or normal saline at 18-month intervals. After 6 years of follow-up, vertebral or non-vertebral fragility fractures had occurred in 122 women in the zoledronate group as compared with 190 women in the placebo group, for a hazard ratio of 0.63. Women receiving zoledronate also had a lower risk of non-vertebral fragility fractures, with a hazard ratio of 0.66. 1,017 serious adverse events were seen in the placebo group, as compared with 820 in the zoledronate group. There were no cases of atypical femoral fractures or osteonecrosis of the jaw in either group. The authors conclude that in postmenopausal women with osteopenia, the risk of fragility fracture was lower with zoledronate than with placebo. Full trial results are available at nejm.org.
Application in medicine. Osteopenia as osteoporosis is a very degree of bone loss measured by bone mineral density, a marker for how strong a bone is and the risk that it may break. The main way to determine your bone density is the has a painless, non-invasion task called dual energy. Dual energy X-ray absorptiometry that measure the mineral content of bone.
Welcome to the UAB Tone Your Bones Osteoporosis Education Series. My name is Beth Kitchen and I am the UAB Osteoporosis Clinic Patient Educator. In this video, we're going to answer the question, what is osteoporosis? When patients tell me they've been diagnosed with osteoporosis, they often say, I have brittle bones or thinning bones or fragile bones. And those are really accurate ways of describing what's happening in your bones when you have osteoporosis. Your doctors will probably use the phrase low bone density, but it means the same thing as thinning fragile bones. This is what osteoporosis looks like. These are pictures of two different bones that we're looking at really up closely through a microscope, magnified about 12 to 13 times. Most people can tell me which of these bones has osteoporosis, and if you chose the one on the right, you would be correct. As you can see, there's a lot less bone there, and the bone that is there is much thinner than the bone on the left. Now, the bone on the left is actually a pretty strong, healthy bone. Many of the bones in our bodies, when they're healthy and strong, actually have this sort of sponge-like honeycomb structure. Now, when you have osteoporosis, one of the things that's important to understand is that you don't feel it, because this thinning of the bones, which is what osteoporosis is, doesn't hurt. Osteoporosis is not the same thing as osteoarthritis, which is a disease of the joints. And so it's happening in between the bones, where the bones meet, such as in this knee joint. So with osteoarthritis, you do feel pain. You might even see swelling and inflammation. But osteoporosis doesn't hurt. It doesn't have any symptoms. It doesn't change how you feel, what you do, how you look. So what's the big deal about osteoporosis? Why do we care? Well, when the bones are thin, like the bone on the right, they break a lot more easily than they would when they're strong. That's the part of osteoporosis that can be painful, debilitating, and really have a negative effect on your life. So everything we do in the UAB Osteoporosis Clinic is geared towards helping you to lower your chances of breaking a bone. So the focus is on fracture prevention. When you hear us use the word fracture, that means the exact same thing as broken bone. Now that you've learned what osteoporosis is, it's time to move on to talking about why you might have osteoporosis. So check out the first page of your Tone Your Bones information packet, and we'll start looking at the risk factors for osteoporosis.
Hi, my name is Retna, and I'm a radiologist technologist here at MD Anderson Diagnostic Imaging Center. Here today we will be talking about bone mineral density, otherwise known as a DEXA scan. A bone mineral density test, or DEXA scan, is one of the most accurate ways of assessing your bone health. A DEXA scan measures your bone loss over time and can detect osteoporosis, which is a disease of the bones. It causes bones to be weak and break easily. The doctor uses the results of the test to evaluate your risk for fractures. At MD Anderson, we use dual energy X-ray absorptiometry, or DEXA scan. It uses X-rays to measure bone density in the hip and spine, and occasionally in the forearm. You are exposed to a very low dose of radiation. Bone mineral density tests are easy and painless. No special preparation will be required. You can eat or drink whatever you like before the test. You will change into a gown, remove any clothing that contains metal buttons, metal buckles, or zippers. Please tell your healthcare provider if you are pregnant or think you are pregnant. A DEXA scan could expose the developing fetus to radiation, which should be avoided. Have recently had any radiologic tests that used an oral contrast dye, such as an abdominal CT or barium swallow. The contrast dye may interfere with the bone mineral density test. You will have to wait 1 week after the radiologic test before you can have a DEXA scan. During the test, you will lie on a cushioned table during the scan. A mechanical arm-like device will pass over your body. This device will not touch you. The radiation dose emitted from the scanner is low, about 1/10 the dose of a chest X-ray. Do not move, as it may cause the image to be blurry. The machine makes a humming sound. There is also a beeping noise each time the camera is repositioned. It may sound like a video game. There is no pain for the actual exam. Some patients have discomfort with various body positioning during the scan. The scan takes about 20 minutes to complete. There is no need to stay after the exam. Your doctor will discuss the results of your test at your next appointment. The result of your scan is usually available after 2 days. Check your MyMD Anderson account for results. There is nothing that will prevent you from safely going home, and you may eat and drink anything after the exam. I hope we've answered your questions about what a bone density scan is. If you have any questions, please give us a call at the Diagnostic Imaging Center, or you can visit our website. Thank you.
Pros and cons. Pros. Reduces the risk of fragility fracture in patients with osteopenia. Treatment of pain syndromes. Reduces the risk of mortality and cancer disease. Cons. Other effects such as the most common is acute phase reaction.
Hi, I'm Dr. Andy Thompson, and I'm a rheumatologist. Today, I'm going to talk about Zoledronate for the treatment of osteoporosis. You can visit our website, www.rheuminfo.com, and print off one of our Zoledronate picto pamphlets to follow along with this video. Zoledronate is also known as a clasta. Zoledronate is given once a year by a 15-minute intravenous infusion. Now, there are 4 things you need to do when taking Zoledronate. First, to help build your bones, you need to take calcium and vitamin D. Your doctor will tell you the right amount of calcium and vitamin D for you. Second, Zoledronate should not be taken during pregnancy or breastfeeding. Let your doctor know if you become pregnant or are planning pregnancy. Third, medicines like Zoledronate have been associated with a very rare problem with the jaw bone. Now, this problem has been seen after dental work. Let your doctor know if you develop sudden pain in the jaw. And finally, your doctor will monitor your response to Zoledronate by testing your bone mineral density. This is usually done every 1 to 3 years. After receiving Zoledronate, some patients have developed a fever and flu-like symptoms where they feel out of sorts or experience chills, fatigue, and weakness. Now, these symptoms are usually mild to moderate and go away after a few days. Zoledronate can cause stomach upset with nausea, vomiting, or diarrhea. Zoledronate can also cause headaches or bone, muscle, or joint pain. Finally, Zoledronate has been associated with abnormal heart rhythms like atrial fibrillation. Tell your doctor if you've had a heart rhythm problem. If you're taking Zoledronate, you should call your doctor if you feel sick after the infusion or if you're concerned about any side effects.
It should apply in Ecuador. In Ecuador, bone density fragility pathologies are common older citizens. Being most frequent elderly women between 60 years old. One cause in the old is ovulation cycles, neutrality. So it is an important option for the patients.
El Patronato Municipal de Ibarra inició una campaña médica de desintometría ósea para verificar los niveles de osteoporosis y osteopenia en los pacientes.
Es un problema que generalmente un gran número de mujeres, principalmente por nuestra constitución hormonal, tenemos en mayor frecuencia, especialmente cuando ya entramos a la etapa de la menopausia.
Sin embargo, también se presenta en pacientes varones.
No es que sea una patología que incida o que tenga una gran, digamos, incidencia y prevalencia a nivel del cantón, pero sí es importante hacerse y dar a conocer. ¿Por qué razón? Porque es muy importante prevenir.
En ese sentido, la campaña también incluye la capacitación en las medidas que deben adoptar para evitar tener estas enfermedades.
Pues nosotros cuando viene un paciente, por ejemplo, con osteopenia, con osteoporosis, además del tratamiento indicado, le damos cuáles son las medidas nutricionales que debe tener. Por ejemplo, evitar bebidas gaseosas, el evitar un poco el café, el comer más alimentos que tengan calcio como el chocho, la soya, etcétera.
La respuesta ciudadana fue positiva en la primera semana de campaña.
Más o menos hemos tenido una afluencia de 60 pacientes al día. Hay que tomar en cuenta que la densitometría es un poquito más extensa porque siempre se demora un poquito más y lastimosamente por esa razón no hemos podido atender a más pacientes porque más o menos estamos en un promedio de aproximadamente en unos 8 a 10 minutos por paciente.
Esta se reanudará a partir del próximo martes.
Vamos a reanudar el próximo martes, miércoles y jueves, es decir, el 5, el 6 y 7 de junio.
La principal causa de la osteoporosis y la osteopenia es una deficiente alimentación en la niñez y adolescencia,
que es donde nuestros huesos se calcifican. Entonces, si nosotros tenemos una buena alimentación durante estas dos etapas, definitivamente vamos a tener un calcio que nos pueda servir en la etapa de la menopausia.
Nancy Valdivieso, Prisma Informativo.
Conclusion: Zoledronate reduces the risk of fertility fraction in older women with osteopenia.